This video looks at a movement analysis of the hip. So we're looking at what movements the hip or can happen at the hip, what planes they move in, and of course the muscles that cause them. Now hopefully you recognise that the hip is a ball and socket joint, a synovial ball and socket joint. And because of the shape of that large round condyle sitting in the fossa of the ischium, the hip, the pelvic bone, ball and socket joints have the greatest range of movement. They move in all three planes of movement, and you can see by this list of movements that they enable a lot of movements to occur. So flexion and extension are always in the sagittal plane, abduction, adduction always in the frontal plane, rotational movements always in the transverse plane, and also you can circumduct at your hip joint, i.e. make a big circular movement with your leg. So let's look at them sort of pair by pair of movements. Hip flexion. Hip flexion means at the hip joint the angle is reduced, and you can reduce that angle by either lifting your leg up or by lowering your trunk. In both cases the angle is reduced. Hip flexion is a reduction in the angle, and it's caused by one of the main hip flexors called iliopsoas. It's spelled iliopsoas, I think it said iliopsoas. I would suggest you maybe remember it as iliopsoas so you get the spelling right. So you can see that it connects to your vertebral column, your pelvis, and your femur. So it pulls your femur up or pulls your trunk down. So hip flexor muscle, iliopsoas. When iliopsoas is contracting to create hip flexion, the partner muscle needs to relax and lengthen to allow that to happen. And the partner muscle with iliopsoas is gluteus maximus, your largest of the three gluteal muscles. However, gluteus maximus is the agonist for hip extension. So if we look at this picture here, if this person was stood in the preparatory position in the normal position with their feet together, and then they contracted gluteus maximus on basically your bottom muscle, it will pull your femur backwards, increasing the angle at your hip, and that is hip extension. Of course, you can also cause hip extension by getting in this prone position. If you laid on your back and you had your bottom on the floor in the preparatory position, and then you contracted your gluteus maximus, that will basically push your hips upwards to create this glute bridge. But this position here, this extension of your hips, is caused by contraction of gluteus maximus. So if I want to do hip extension, as in preparing to kick a football or a rugby ball, pull my leg backwards, my gluteus maximus contracts as the agonist, my iliopsoas would need to be relaxed and lengthened to allow or control that movement. Then we've got the frontal plane movements, abduction and adduction. Let's look at abduction first. So from the anatomical position, if I lift my leg up sideways away from the body's midline, that's abduction, increasing the angle and moving away from the body's midline. The muscles that pull my leg sideways, and you can see them on the diagram over here, are gluteus medius and minimus. The smallest one is minimus, medium size one is medius. Now gluteus maximus is more posterior, it's more on the back of your pelvis, the back side of your bottom. Gluteus medius and minimus are a little bit more to your side. So they pull the femur sideways, okay? So they're the agonists for hip abduction, gluteus medius and minimus. The partner muscle group are on the inside of the thigh. These are called the adductor muscles. So when gluteus medius and minimus are contracting to abduct at the hip, the adductor muscles must be relaxed to allow that movement to happen. They are the antagonist in that particular movement. If you want to actively pull your femur towards your body's midline, so pull your legs together, you could be in a seated position and pull your leg together. That would be adduction, moving towards the body's midline. The adductors contract to do that. And it would be great for you to learn that you have three adductor muscles in this group: adductor brevis, magnus, and longus. They actually vaguely make sense. Longus is the longest one, the green one. Magnus is the blue one, the strongest one. And brevis is the shortest one. If somebody's brief, they're quick, aren't they? The short, it's a short meeting, a brief meeting. So the purpley pink one there is brevis. Brevis, magnus, longus. They are your adductor muscle group. You get exercise machines in the gym where you've got to have the weight on the inside of your leg and pull your leg inwards. That's the adductor machine. You put the resistance, the machine on the outside of your leg and push, I guess, your leg away from the midline. That's the abductor machine. So pairs of muscles, the adductors and gluteus medius and minimus. And these movements happen in the frontal plane, as you, I'm sure, know. A bit like the shoulder, the hip can do horizontal flexion and extension, or horizontal abduction, adduction. So the same sort of away or towards the body midline, but in a horizontal position, in a parallel to the ground position. I think it's unlikely you'll be specifically asked on this, but I'm showing you anyway because this joint can do it. So horizontal extension is movement away from the body's midline, but parallel to the ground. Horizontal flexion that way is movement towards or across the body, but horizontal or parallel to the ground. And the adductors and the gluteus medius and minimus are the similar muscles that would cause this movement. Now, a bit like your shoulder, your hip, or specifically your femur, can also rotate. So your femur rotates longitudinally in the hip socket, in the pelvic socket. So this person, to get into this position, has externally or laterally rotated this leg, but she has internally or medially rotated this leg. If you stood still and you laterally rotated one leg so that your whole leg was pointing sideways, that's lateral rotation of the femur at the hip joint. Again, I'm pretty sure you won't need to know the muscles for this action, but just need to know that your hip can laterally or medially rotate. Lastly, just to recognise, again, like the shoulder, that your hip can circumduct. So the proximal end of the femur obviously stays within the joint, fairly static, but the distal end of your femur makes a circular movement, or your leg makes a circular movement. That is circumduction at the hip joint. So when you perhaps do a step over in football, you make even though your leg is often flexed in doing it, you make a circular movement at the hip joint. That is hip circumduction.